Shaun Summers, resident of Port Colborne.
See and hear me?
You're on.
All right. Thank you very much, Chair Bradley and members of council, particularly for permitting me to speak, even though my request was late. I do appreciate it. My name is Shaun Summers, as mentioned, and I am a resident of Port Colborne. Tonight, as you might guess, I am here to speak against the mask mandate extension. Many of the previous delegates have spoken against the mask mandate because they feel like masks don't work. Now, as much as I do agree with most of their points, and as quoted, Dr. Anders Tegnell of Sweden did say that the evidence is astonishingly weak, quoted by our second delegate tonight. That's not the primary point that I'm looking to make tonight. I'm looking to talk about the mask mandate and if mandates themselves work and if they're a scientific proposition and if there's evidence that they work. I think that's really the most important thing that council should be considering tonight. Now, first off, though, I do believe that a properly fitted, properly donned and doffed mask of the correct type, worn correctly, is probably of some utility in certain circumstances. Now, the mask mandate certainly doesn't go anywhere near that detailed. Basically, the mask mandate does boil down to have some fabric over your nose and mouth when you're out indoors in public. So leaving aside that, and then of course that does have some real issues regarding whether or not that's very effective at all. Let's take a look at the mask mandates. I think we do have to look at them separately. I'm really quite concerned that council has already imposed or mandated and is looking to extend a mask mandate that is not scientific. And what I mean by that is this. Any scientific hypothesis or proposition really must be falsifiable. There has to be a way to evaluate it based on evidence and see if it's working or not. What I would ask any of the councillors, and I believe most of you did last time, vote for the mandate, what evidence could someone show you that the mask mandate that you put in over the past 2 months was not working or did not work? It didn't reduce spread, it didn't accomplish anything. If you can't think of any, even an imaginary example of how that could be untrue, then really we're not doing science anymore. We are doing either faith or superstition. We're just really going that, well, we think mask mandates work, let's roll with it, right? Now, you've heard from others say that masks being imposed could be harmful. We'll talk a little bit about that in a bit, but I really do think that there's really only 3 possible outcomes when a mask mandate is imposed, right? We can look at if we're trying to prevent spread of the virus or any virus, once the mask mandate is imposed, the cases could go down. And therefore, I think people would say, well, look, the cases went down, the masks worked. The cases could stay the same. And people would say, well, look, the cases stayed the same. So obviously, mask mandates work. Of course, the third possibility is that the cases start to go up. And here's where the problem comes, because most people aren't going to say mask mandates don't work. They're going to say, well, it would have been worse if we didn't have our mask mandate. Mask mandates work. So you can see that there's a real problem that we can't accurately evaluate whether or not any mask mandate works. And I think if it was easy to determine, we wouldn't have to have this discussion. We wouldn't have to have a whole lot. We could just point to the facts and say, well, look, over the last 2 months, they definitely worked. But because this isn't an evidence-based or scientific mandate, we can't really do that. So we're stuck kind of here having a discussion, and hopefully we're learning some things together about masks and mandates. So I want to draw your attention just to something that Carl Hennigan, Professor Carl Hennigan, who is the director of evidence-based medicine at Oxford University in England, what he said was regarding a study done in June by the country of Norway, which was looking specifically at should there be a mandate on presumably healthy people, so people with no symptoms, out in public, should they be wearing a mask to reduce the spread? And what he said, we reckon that at least 200,000 people would have to wear a mask for a week to prevent one infection. So if you want to put a policy in place, fine. But what you can't do is say it's evidence-based, okay? And I think evidence-based policies are the way to go. And hopefully you agree with that. as a member of council, that if we're putting something in place, there should be evidence that it's working. Well, maybe we can't say over the short duration of a 2-month mandate we've had here in Niagara, whether or not they've worked. But can we look elsewhere around the world and have mask mandates worked in other places? Sure, of course, we all know mask mandates have been put in place indoors, outdoors, on transit, different areas, but primarily we're looking at mask mandates for indoor use, at least. They've been put in place many countries or areas or states or provinces all over the world. Have they worked anywhere? Here's a list of places where after the mandate was put in place, cases went up, either sharply right away or even after a little bit of time, okay? So in Venezuela, in Vietnam, in the Czech Republic, in Slovakia, in Bosnia, in Colombia, in Cuba, in Morocco, in El Salvador, in Argentina, in the Philippines, in California, in New Mexico, in Spain, in France, in Hawaii, and in Peru. Perhaps you guys are aware of Peru. Recently, Peru became the worst country in the world for coronavirus deaths. And of course, one of the worst countries in the world for coronavirus cases per capita. They've had a strict lockdown since March and a mask mandate since April. And they're now number one. Well, not a good number one. They're the worst country in the world for coronavirus deaths. The mask mandate, there's really, I don't believe, anywhere in the world where a mask mandate has turned the course of the infection down. Of course, there are places where cases went down after the masks were imposed, but we can see some of those places, New York State in America, for example, the cases were on their way down anyway. And of course, we've seen in the Netherlands and the Nordic countries where masks in general have not been mandated, the cases went down there anyway too. So I think we can sort of see that maybe masks aren't totally necessary in that way. And of course, most importantly, I think, here in Ontario, we saw cases go down from April to July without mask mandates, okay? So that's an important thing to consider. Masks do have drawbacks, risks, and costs. Some of the previous delegates have already talked on those issues. Just this morning, I was speaking to a group of kids. I was talking to them about economics. I was talking to them about how a good economist or good public policy looks not only at the effects on one group of people, they look at the effects on everyone. Not only the short-term effects, but also the long-term and unseen effects particularly, okay? It's very easy to put a mask mandate in place so we can see people wearing a mask, okay? But what we don't see are the unseen effects, the people who are unable to wear a mask but too ashamed to go out without wearing one, okay? The people who are struggling because of not being able to hear other people, so they choose not to go out and become more and more isolated. People who just in general, they can't see the facial expressions or the humanity of other people because of masks being covered up. A little known risk, but a real one, trips and falls. If you're wearing a surgical mask or almost any mask, it's occluding the lower field of your vision for a senior. That can be an increased risk of trips or falls. So actually try that yourself. If you've never done it, a mask, you can't see the floor. It can be dangerous. And of course, breathing difficulties. It's not an issue for most people. I've worn a mask at my work and I'm able to breathe in it, but we are mandating that people cover up the only 2 holes that we have to breathe with in our head. So there's got to be some level of breathing restriction. Obviously, that's the very point of a mask, is to restrict the air that's coming in and filter it to some extent, or the air that's going out, okay? We're clearly trying to affect breathing by doing that. And of course, there's the risks of the actual health risks of masks, which I would remind us all has been reminded. Every health expert in the world was reminding people of in March that masks, if not properly worn, okay, can actually contribute to illness and contribute to viral spread from the contamination, from the touching. It can make people, and this is a big one, people feel more comfortable reducing the social distance, reducing from 6 feet to even 4 feet, right? Like, we have to be careful that the masks don't have the unintended consequence of doing something we are pretty sure works, keeping a distance from people who might be ill, to relying on something we actually are pretty sure the evidence shows not working, not too much certainty of working, which is masks when people are stuck close together.
Just want to remind you, you're close to the 10-minute mark.
I will.
Half a minute left.
Half a minute. Well, let's get going. One thing is really important is the need. We only have the main risk for spreading the virus is 15 minutes of close contact with an infected person. And I think in Niagara shopping, I have not once had that issue in the past month and a half, or sorry, in the past 6 months of pandemic times. I have not been stuck 15 minutes with somebody at No Frills or anywhere else. So in conclusion, tonight you're considering an extension to a further 7 months of this mask mandate. I believe this mandate lacks a scientific basis to be continued, and certainly lacks any evidence-based measures to determine whether it is helping, useless, or even harmful. Without targets or objective measures of efficacy, will we not find ourselves here again in April having the same discussion? We can prevent that if you vote no tonight. Now, no doubt you've heard many of your constituents, one way or the other, pro or con. Hopefully you've really listened tonight, and I've done my best, and the other delegates have as well, to show you that the bylaw itself is unscientific, potentially harmful, and unneeded. I urge you to do what's right for Niagara, allow voluntary action to work as it did from April to July 23rd, and vote against the extension of this bylaw. Thank you very much.
Thank you, Mr. Summers.